Two major health groups are coming out against Health and Human Services guidelines on vaccines. The American College of Obstetricians and Gynecologists saying Friday, quote, COVID-19 vaccines are not only completely safe for use during pregnancy, but also protective both during pregnancy and after the infant is born. This came days after the American Academy of Pediatrics recommended young children get COVID shots. HHS responding with this statement, quote, HHS and CDC will continue to be the official resource for any guidance. Let's bring in Fox News senior medical analyst, Dr. Marc Siegel. Dr. Siegel, this back and forth between a couple of professional associations and the federal government, does it surprise you?
It doesn't surprise me. And they're not always necessarily looking at the exact same studies, John, or interpreting them the same way. I think the point that the American College of Obstetrics and Gynecology is trying to make is that during pregnancy, it's a state of semi-immunocompromise, and a lot of pregnant women have gotten sick from COVID and been hospitalized. And young children who have pre-existing conditions, there's been issues with them being hospitalized, over 2,000 over the course of the pandemic and since, with pre-existing conditions mostly. And I think they're looking to see that these remain as tools that can be used. You know, there's a study out of McGill in Canada that the two sides interpreted differently. Kennedy's group interpreted it as premature birth was more likely, but the authors out of McGill said, no, that's because of other factors, not the vaccine. This could be seen as a healthy debate if it leads to more study. But the question of whether the mRNA vaccine remains as a tool for COVID, especially if COVID comes back, is important. And my view is that it is a useful tool. But I also wonder about another point that Kennedy has made, where I agree with him totally, which is that big pharma plays a role here with deciding what vaccines are prominent. I wrote an article in the Wall Street Journal a couple of years ago about Novavax, which is a lot like the shingles vaccine, and that got sidelined because of all the attention paid here. And there are other newer vaccines and older technology that also may be useful. The advantage of mRNA technology is that it can be created quickly if there's an emerging pathogen, if there's another pandemic that came along. That's a very important use, as is cancer, the use for cancer vaccines. Yeah. So all of this could be a healthy debate. It shouldn't be, in my opinion, litigious. It should be a debate.
And you've also made the point, when I've talked to you before, about the fact that natural immunity from COVID was never really considered in any of these, federal tests.
And that's one of the reasons, and Marty McCary and I both made that point, and that's one of the reasons that the public lost confidence, because they were told this is mandated, it's my way or the highway, natural immunity doesn't matter. Well, it turned out that studies showed that if you had just had COVID, you didn't need a vaccine, you shouldn't have a vaccine, and you shouldn't have been told you can't go to work. You should have been allowed to go back to work because of the immunity you had from the virus. And all of that, an emergency use authorization that became a mandate that got extended, led a lot of the public to distrust public health officials, and that's something that needs to be rebuilt here.
Meantime, RFK Jr.'s Health and Human Services department is unveiling a new transparency tool, they call it, MAHA in action. And for instance, in the state of Texas, apparently, you're going to start seeing warning labels probably in 2027 about some of the ingredients in foods, ingredients that have been banned, frankly, in Europe and some other places. What do you think about that, Doctor?
I love this tool. I've been looking at it for the last few hours, and it lists the 12 states where there's, been restrictions made to SNAP, to food, through the SNAP program, where you can't have as candy or sugar, as much sugar in there, or dyes, and then school lunches, warning in 8 states so far, warning that, you can't have these dyes. 22 states are saying, John, 22 states have restrictions on cell phone use. I love that. That's a huge problem. Even Ezekiel Emanuel, who was Biden's COVID advisor, came on Fox and Friends this week and said, whoa, I don't let that in my class in the University of Pennsylvania. Completely agree with that. And mental health services are going to be looked at, and transparency. The whole idea here is to have a tool where you can go online and see what HHS is doing, what they're doing to make America healthy again, what they're doing to make it so that kids aren't exposed to this amount of dyes, sugars, and unhealthy foods, which leads to obesity and chronic disease. All in on that.
Yeah, let's see if this new tool does help make America healthy again. We know you're trying to do your part. Dr. Marc Siegel, thanks very much.
Thanks, John. Good to see you.
You too.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.